Please, okay. May I request that everybody just keep their monitors on mute as well. If we have too much noise, we'll mute everybody and then we'll restart again with Dr. Harish as well. The questions put though, please do so. And I'm gonna let Dr. Harish do his presentation. But presentation purutase. Yeah, you can ask as many questions as you like. I think if we can put it in, if you've got the facility to put the question in the chat, then Kitty Benan will pick it up and we will then relay it back to Dr. Harish. And then after that, we can have a sort of chat after that as well. Okay. Okay, Dr. Harish, over to you.
Hi, good evening and Kemcho. Jara correction, can I kidu ke blood pressure? The talk today is about numbers, not just blood pressure, right? There are thousands and thousands of numbers. It's not straightforward, right? So, but we can start with the blood pressure because our main problem usually our friends and family में बात करें तो more pressure more pressure વધારે. So most people are really worried about their blood pressure. So let's start with some numbers with blood pressure. So Kirti, next slide, please. Kirti, next slide. Yeah. So first of all, the blood pressure map by cam mapeche, mapocho, it's the most important thing. All right. So it's really, really important how you measure your blood pressure. The latest iWatch, things like this, they can measure your blood pressure if you put your finger on it, etc. You can have a wrist one. But the best blood pressure machine is a bit like this, all right? A bit like that. These are the best. They're about 30, 35 pounds on an on one. And they must have at the back something called CE. All right, you can't see it, but there, CE. Unless they've got CE at the back, they're not good enough, really. It's got to have a CE. It's like a kite mark, all right? And also a cuff. Oi, this is the one that goes on your arm. It has to be the right size because, people have fat arms, so people have very thin arms. But for an average size arm has to be that sort of machine. It's about how much is it? It's about 14 to 17 centimeters. But if you've got a fat arm, you need a bigger cuff. So you got to buy another cuff. It's not all one size fits all. It's a different one. So a decent blood pressure. And then when you take the blood pressure, your blood pressure mapo tame, you've got to sit down and relax for 5 minutes. Okay. And then you have to do it 3 times. Because doctor में जाओ and पहली बार blood pressure कैसे it'll be high. And if the doctor just does it once and the blood pressure is high, he puts you on tablets, he's putting you on tablets for the wrong reasons. All right. So it's better to measure it at home if you can do it at home, if you can afford a reasonable machine. Um, so you sit down and then you put your cuff on, you relax for 5 minutes and then do it 3 times. Okay. And whichever is the lowest out of the three readings, thrown reading matije ocham ochue, that's your blood pressure. And there'll be a figure at the top and a figure at the bottom. All right, simple. So if you don't do the blood pressure properly, it won't work. All right, the blood pressure, and you can be on lifelong treatment forever. Where I mean, when they are heroin and brandma. So if you go to your GP, they can send you to the local pharmacy and they can connect a little machine with your chest and here and if 24 કલાકનું એ blood pressure માપી શકે to be 100% sure કે તમારા next 50 to 100 years you're going to have the blood pressure treatment. Blood pressure treatment is not like antibiotics, it's for life. All right, because your blood pressure તમારો વધારે રહે, it's going to damage the arteries, it's going to damage the eyes, it's going to damage the heart, arteries up there, and it's going to damage the kidneys. So, and it's a slow damage. It doesn't happen overnight, all right? It happens as the years go on, all right? So that's how you do the blood pressure. And it's not as simple as one blood pressure, it's high. And there's always chance to wait, unless it's really high, the blood pressure. The blood pressure. And let's have the next slide, Kirti Ben. All right. So the blood pressure mapo, it depends on તમારી કેટલી ઉંમર છે, your age. પછી બીજી બીમારી, diabetes હોય, kidney problem હોય, heart problem હોય, strokes થયા હોય, then it's a different blood pressure. Blood pressure machine તો વાત કર્યું અને મેં તમને બતાડ્યું કે રીતના blood pressure કરવાનું. Next slide, please. Okay. Now તમે જુવાન હોય, when I say જુવાન, you're probably about less than 50, I should say, and you've got no illness, કોઈ બીજી બીમારી ના હોય, Then તમારો સ્ટાન્ડર્ડ હોવું જોઈએ 130 ઉપરનું ને નીચેનું 80, 80, 130, 80. Okay? That's your standard with no illnesses and under the age of 50. If you're over the age of 50 and no illnesses, 130, 80 is normal. There's nothing to worry about. All right? Next slide, please. But તમારી ઉંમર વધારે થાય, if you're over 75 અને બીમારી ના હોય, આસ્તે આસ્તે blood pressure વધશે તમારો. So even in that 150, 80 હોય, if your age is 75, 75 જેટલી ઉંમર હોય, that's normal. I'm not worried about it. Because તમારું blood pressure તું બહુ ઓછું કરીશ તો તમને ચક્કર આવશે, પડી જશો, હાડકા ભાંગશો. All right? So at the age of 75 or over with no illnesses, 150, 90 is completely acceptable. So don't go running to the doctor, તમે ઘરે માપો, for tablets because you're wasting your time, all right? Unless it's very high. Next slide, please. Now, તમારી પાસે હાર્ટ ડિઝીઝ થયો હોય, કદાચ હાર્ટ અટેક થયો હોય, કદાચ હાર્ટ ફેલિયર હોય, ડાયાબિટીસ થયો હોય, સ્ટ્રોક્સ હોય, કિડની પ્રોબ્લેમ હોય, ત્યારે it's very, very important that ત્યારે તમે blood pressure ઓછું કરો, less than 140, 90, but ideally it should be 130, 80. All right? Now, sometimes it's difficult because તમે જે ઉંમર થાય માથામાં arteries હોય ને એ hard થઈ જાય. All right? And meaning કે પ્રેશરથી ઉંમરથી hard થઈ જાય arteries. The blood pressure બહુ જ ઓછું કરશો તો તમને ચક્કર આવશે ને પડી જશો. All right? So as a see, there's no what they ઇંગ્લિશમાં કે one size doesn't fit all. We have to measure the blood pressure. And although I'm giving you a talk today, it's best that your doctor knows about it. So your doctor has got the medical history and everything. So don't rely on what I'm just saying. But because he's got the medical history from our doctor, the computer, it's better you go to him. Yeah. But this is just general rules. Okay. Next slide, please. Because મેં તમને કીધું તમારું blood pressure બહુ ઓછું થાય તો તમને ઠાક લાગશે, ચક્કર આવશે અને તમે પડીએ જાઓ. So તમે blood pressure માપો. So the second way of doing the blood pressure better is ઊભા થઈને blood pressure. Okay, 1 minute ઊભો રહેવાનું, blood pressure નો cuff નાખવાનો અહીંયા, and then just press it. Now blood pressure જો બહુ ઓછું થઈ જાય, then it's a problem. તમે દવા ખાતા હોય, બીમારી હોય, પાણી ઓછું થઈ ગયું હોય, blood ઓછું થઈ ગયું હોય બોડીમાં, then the blood pressure તમારું બહુ ઓછું થાય, then it's a problem. And they make a postural hypotension, low blood pressure when you stand up. Okay? એવું થતું હોય તમને, then you have to see the doctor. એટલે ચક્કર આવતા હોય, I always stand the people up, patients up, and they have to have the blood pressure done. Okay? Next slide, please. So best person to help your blood pressure is your GP, all right? And they can bring your blood pressure according to your age, according to your illness, kay bimari she, and he'll get it right for you. Yeah. Okay. Okay. It's just a question in there. So if you're old and the blood pressure is 130, 135 with the help of medic, what do? Leave it. All right. That's a good blood pressure, but don't go any lower. Okay. I don't know who asked that question, but don't go any lower. All right. Jackison. Okay. Now, next slide, please. Next thing that's important is the pulse. You know, નાડીમાં આર્ટરીમાં કેટલું છે. ઓલરાઈટ, એમાં છે ને whilst ઘણી વાર પેશન્ટ્સ આવે હું પૂછી લઉં કે ક્યાં દુખે છે, ક્યાં નથી દુખતું, શું કરો છો, શું કરતા, છોકરી કોની સાથે ભાગી ગઈ, છોકરો કોની સાથે ભાગી ગયો. At the same time, I'm measuring the pulse. And it's a pulse I'm measuring in a rate, એટલે મિનિટમાં કેટલી વાર હોય. Irregular છે કે irregular છે, તો બતાવ્યું. ઘણી વાર આપણા palpitation થાય ને, તો this is regular, તમારો heart pulse. સંભળાય? This is irregular. And ખરાબમાં ખરાબ હોય, this is the worst one. Very irregular. એ તમે control ના કરો, then the strokes થાય. Any age. Okay? Okay? અને બીજો pulse તમારે જાણવું હોય, 40થી ઓછો pulse હોય, તમારા મશીન ઉપર કે એ તમારે ડૉક્ટર પાસે ચેક કરવા પડે કે 40થી ઓછો persistently રહે તો તમને હાર્ટમાં pacemaker નાખવા પડે to control the heart to 60 or 70. All right? So under 40, only person 140 or 100-meter runner, yeah, the Usain Bolt, who was running 9.58 for 100 meters. He's the only one who can get it down to 36 per minute, and that's healthy for him. Okay. Normally, તમારો pulse હોવું જોઈએ 70 to 90, but ઓછું હોય જરાક વધારે, it doesn't matter. Don't get too fixed on it. Don't get too fixed on it. But irregular હોય આવું, અને થતું હોય palpitation, then you need to get it checked by the GP. All right. Okay, next one. Breathing, શ્વાસ કેમ લેવો છો તમે? નોર્મલી તમે મિનિટમાં 16 થી 20 વાર શ્વાસ લે. એટલે ઘણી વાર હું આ પલ્સ લેતો હોય તો આઈ એમ લુકિંગ એટ પીપલ્સ ચેસ્ટ કે હાફ ચડે છે, સ્લો છે. Normally it's about 16 to 20 per minute. Okay, પણ તમે કન્ટિન્યુઅસલી આમ રહેતું હોય, that's abnormal. All right, and meaning કે તમારા હાર્ટનો પ્રોબ્લેમ છે, થાઇરોઇડનો પ્રોબ્લેમ છે કે લંગ્સનો પ્રોબ્લેમ છે. All right, so જરાક ચાલો ને બહુ હાંફાઈ જાય તમારાથી, then the doctor has to look at it again. All right. Okay. Once you start, જે કે તમે કશું તમે દવાની સ્ટાર્ટ કરી નાખો, you can't stop it really. It's lifelong, because તમે blood pressure પાછું વધશે, ઓછું થશે વધશે. It's dangerous for the heart, it's dangerous for strokes. Okay. And તમને વિચાર કરો કે આ આર્ટરી હોય આવી રીતના અને એમાં પ્રેશર રહેતું હોય, the artery will get harder and harder and harder, then the blood won't go through. Okay, then you have strokes, you have dementia and everything like that. Okay. Okay, next slide please. Diabetes. Heroma, 1 in 10 person has got diabetes. Most of them are Indians. Okay, and it's a very high rate of diabetes in Indians, and they are the ones who get heart attacks. They get gangrene, Gujarati, what do you call gangrene? You know, circulation ઓછું થઈ જાય પગમાં. So ત્યાં તમને વોર્ડ ઉપર લઈ જાઓ અહીંયા હેરોમાં, 80% of the people who have their legs cut off, pag kappa pade, are Indian, and they have diabetes. All right. So unless our diabetes control kare, then you're in trouble. The best test is HbA1c. એ છેલ્લા 3 મહિનામાં કેટલું sugar level છે દરરોજ ટેસ્ટ કરો. Unless તમે insulin खाता હોય કે તમારો diabetes unstable હોય, it's a waste of time દરરોજ. More importantly, તમે શું ખાઓ છો, શું નથી ખાતા, that's the most important thing. Because the HbA1c એ છેલ્લા 3 મહિનાનું average sugar test control. And average તમારે diabetes હોય તો you should be less than 55 or 60, around 55, 60, then it's good control. Okay. 80 થી વધારે રહે A1c, then you have to be on insulin. There's no joke about it. Okay, you're in trouble. All right, you're in trouble. Okay, so more than 80. Okay, now if you take insulin, then દિવસના 4 વાર કરે. ને કહેતા હવે તો અહીંયા સ્પોટ આવે છે એવું, એ તમારા ફોન ઉપર શુગર તરત લેવલ કહે છે Libra 2. All right, તમે જીપીને કહેશો ને કે નર્સને કહેશો ને ત્યાં આવશે. Now દરરોજ ટેસ્ટ કરવાની is a waste of time for most people. So it's best તમે diabetes હોય તો ખાવામાં carbohydrates, એટલે rice, potatoes, chapatis, sugarનું ખાવાનું હોય, biscuit, ચેવડો sugar વાળો, all of those has to go. All right, you have to cut it down. Okay, vegetables all right, meat is all right. Okay, so but if you're a vegetarian, obviously it's not a good idea to have your meat. Yeah. Okay, so that's diabetes control. Now અત્યારે સ્ક્રીનિંગ કરો છો ડાયાબિટીસ 47 થી વધારે હોય બે વાર ટેસ્ટ કરશે ડૉક્ટર. આજે કરશે ટેસ્ટ ને 6 વીક પછી ટેસ્ટ કરશે, unless તમારો A1c is very high. All right, બે વાર 47 થી વધારે રહે, that means you can get diabetes or you have got diabetes, so you need hard treatment. Okay, અત્યાર સુધી most people had to go on one tablet, but as of next month, on the type you get diabetes, you'll be put on 2 tablets. One is a tablet which is we have been giving for years, something called metformin. Yeah. The second tablet is called, I'll give you the medical thing. It's called SGLT2 inhibitors, all right? And the issue with that is that it protects the heart and it protects the kidneys. So if you're going to heart failure or kidney failure as a result of diabetes, you should be on 2 tablets from the day one of diabetes. અને તમે અત્યારે diabetes હોય તો maybe you should તમારા GP પાસે જઈને કહેજો કે ઓલી SGLT2 inhibitor. All right? I'll put it in the messaging thing. SGLT2 inhibitor. All right? Your GP should put you on it. Okay, and it's going to be in the guidance, national guidance, and a nice guidance question. It's going to be in the national guidance, but I've been doing this for a few years now, and really, you have to stop kidney disease and heart disease. Okay, so these are some numbers in diabetes. More than 48 twice or 47 twice, you have diabetes. All right, you can do anything. Channel 888 Ramdev નથી પેટની exercise કરે. You can try. It's not going to, your diabetes is not going to go away. It's going to be for life. Unless you lose weight, unless you cut down the thing, and your level goes below 35. Yeah. 47 is diabetes, 47 and more is diabetes, but it's below 35, then you're cured. Okay. A professor in Newcastle, he's been doing it for about 10 years, but it's a very low calorie diet. Like ખાવાનું, fruit, પ્રોટીન વાળું ખાવાનું, એમાં કેલોરીઝ નહીં હોય, પાસ્તા ન હોય, potatoes નહીં હોય, chapatis ન હોય, sugarવાળી વસ્તુ નહીં હોય, biscuits નહીં હોય. And he puts them on 800 calories a day diet, and 6 મહિના પછી diabetes જતું રહે. પણ એ જ્યારે ઓછું કેલોરીઝનું diet બંધ કરો એટલે diabetes પાછું આવી જશે. You have to control it forever because diabetes doesn't go away, sadly. It's like there's no medicine to stop you becoming old. All right? ઉંમર થવાની તો ઉંમર તો થશે જ. બીમાર થશો તો બીમાર તો થવાના જ છે. But we can stop the heart disease, we can stop the kidney disease by good control. Yeah, got it? Okay, right. Next slide, Kirtida. So there we are. If it's less than 40 HbA1c, all right, it's okay. Okay, just have to look after yourself. If it's between 40 and 46, really, you're on the verge of getting diabetes in the next 10 years. All right, unless you lose weight, unless તમે કાળજી રાખો dietમાં, unless તમારો blood pressure control. So be really careful if your HbA1c is between 40 and 46. Yeah. Next slide, please. So GP પાસે જાઓ તમે તો તમને blood test કરી શકો. અને બીજું તમારો કિડનીનો ડેમેજ હોય એ તમારો કિડની છે ને એ પિશાબમાં ચેક કરે. અને વ્હાઇટ ટોપની બોટલ આપશે. એની અંદર સવારના તમે ઉઠો ત્યારે પિશાબ કરો ત્યારે અંદર માપશે ACR પ્રોટીન. એમાં પ્રોટીન જે નંબર વધારે હોય, લાઈક લેડીઝનું 2.5થી વધારે અને મેનનું 3.5થી વધારે, then it means you got kidney damage. But if you go on the medicine called SGLT2 inhibitor, it will stop the damage. Doesn't mean it's going to get rid of it, it will stop the damage. Okay. અનિલભાઈ ક્વેશ્ચન પૂછે છે, ઘણી વાર છે ને બ્લડ પ્રેશરની દવા ખાઓ ને તમારું પલ્સ રેટ ઓછું થાય. સો ધીસ ઇઝ સમથિંગ, એક દવા કહે છે બીટા બ્લોકર્સ કરીને દવા. Okay, atenolol, bisoprolol, metoprolol, છેલ્લું નામ આવશે LOL, LOL. Now, blood pressure માટે control કરો, but 55 થી ઓછું થાય, so that means it's your maximum dose of beta blocker drugs. Bisoprolol, atenolol, metoprolol, all right? Now, 55 to ochu thai, you have to talk to the doctors, all right? Because that's the maximum tolerated dose. The dose વધારે કરશો, blood pressure, pulse rate ochi thase, and then you'll have all the problems. Yeah, then I hope that answers your question. Next question, next slide, please. Cholesterol. Everyone's worried about cholesterol. Now, cholesterol is not one figure, all right? There are four or five things we look at, all right? The first thing we look at is total cholesterol. And the total cholesterol is આખી બોડીમાં કેટલો cholesterol છે. So that doesn't answer. ઘણી વાર તમે કેમિસ્ટમાં જાઓ તો ત્યાં એ લોકો blood cholesterol કરશે. It's in a way waste of time, really, because we need everything else underneath there. You need HDL cholesterol. HDL cholesterol means It's good cholesterol and it's good for your heart. All right. This is not a bad cholesterol. The one below that is the non-HDL cholesterol, is bad for your heart and it gives you heart attacks. Okay. How do you increase HDL cholesterol? The only way તમે HDL cholesterol વધારશો is by exercise. There is no drugs. Okay. So tomorrow total cholesterol say is 6, the HDL is 2. You don't need any treatment. You don't need anything, although the cholesterol is high. All right. You don't need any treatment. So you have to look at all those HDL, non-HDL. All right. Now, non-HDL is the bad cholesterol, all the bad cholesterol in the body, non-HDL. If it's more than 3.9, all right. And તમને કહું છું figures because a lot of people are using the NHS app. So you click કરો તમારા phone ઉપર કે iPad ઉપર, on the NHS app you can see all the blood results. All right. And if it's more than 3.9, you have to do something about it. All right. You have to see your GP and they can give you tablets for cholesterol or something called triglyceride. But triglyceride comes in that, the non-cholesterol. All right. So there are different types of cholesterol, not one figure for cholesterol. So be careful with that. Next slide. Now the doctor, blood test but there are lots of liver tests, all right? Bilirubin, alkaline. Now, but the abnormal hoy kadash, then you could have hepatitis, you could have cancer, you could have all sorts of things. And cello test, if you drink too much, that serum gamma GT will go up. All right. I haven't written the figures there because it takes years to learn it, and we're all lay people here, so it is unlikely anyone's going to take it in their head. But if you look on the app, it'll say the normal figure for alkaline phosphatase is up to 35, all right, etc. Jackison by the answer is the slow release metformin is definitely better than metformin on its own because you get more side effects for ordinary metformin. But if you're okay on that and diabetes control, not a problem. So that's liver test. Next numbers. Right. So we're all worried about vitamin D. So from about September until March, our country માં તડકો નહીં મળે. So normally, સ્કાયમાંથી તડકો લાગે આપણી ચામડી ઉપર. It converts chemicals in the body to vitamin D through the liver. All right. For 6 months, there is no sun in England. So તમે retired હોય તો 6 months ઇન્ડિયામાં રહ્યો, short sleeve shirts, trousers પહેરને, shorts પહેરીને તડકામાં બેસો તો you get enough sun. But our country there is no sun, all right, until June. So vitamin D level you can either have deficiency, pachis ocho, or you can have something called not deficiency but inadequate. So the deficiency હોય તો high dose vitamin D માં જવા પડે 6 weeks સુધી, and પછી normal vitamin D either તમે chemist માંથી buy કરી શકો or the GP can give it. It's about 20 to 40 milligrams a day or 1000 units, international units, IU a day. All right. Vitamin B12 is a bit more serious than vitamin D. Vitamin D is serious, all right? It can affect your way you think, tiredness, and bones get thin, especially women after the menopause. Okay, the period stop hyperchi. Vitamin B12 is also a serious matter. ઘણી વાર છે ને પેટમાં પ્રોબ્લેમ હોય, તમારી બોડી સાથે તમે એન્ટીબોડીઝ બનાવો પેટમાં, એટલે વિટામિન ડી એબ્ઝોર્પ્શન ના થાય અને પગ જૂઠા થઈ જાય, dementia થઈ જાય. So પહેલા તમે vitamin D ની tablets જ આપતા, but we know now because you get 5 injection when the vitamin D B12 is deficient over 2 weeks, 5 injection મારવા પડે. And if you have to carry on, then you have 1 injection 4 times a year, every 3 months. Then you don't worry about blood test ever. All right, and it's 4 injection is nothing really in a lifetime. Just have to make 4 appointments. Folic acid is not too bad. The folic acid ochu hoy, then you're not eating enough fruit, you're not eating any vegetables. All right, so you have to increase your amount of fruit. Our country my name che medical market, you have to have 5 different colored fruits a day. All right, now it's not as easy as that because the grapes cow it's got full of sugar, so if you've got diabetes it's no good for you. So the best fruit for diabetes in most people is berries, all right? And they've got to be different colors. You got blackberries, you got blueberries, you got strawberries, you got gooseberries, all right? Any berry you eat, that much is a portion, about 20, 25 grams. The reason I know because I weighed it, put it on a kitchen scale, it's about 20, 25 grams, and that's how much you eat. Grapes no portion, 9 grapes તમે ખાઓ, and that's all you have to eat. That's a whole portion of sugar for nearly a day, all right? You can eat bananas, a few times a week. You can eat apples. You can eat satsumas, clementines. They're okay. Calcium is a different matter, right? Now, calcium can be high and low because of the body ma cancer or anything like that. All right. So if the calcium level is high, you have to go to the doctor and they have to make sure they do further tests to exclude anything nasty or sinister. Okay. Okay. Next slide, please. બીજું ઓછું થાય is થાક લાગે and majority of the people જે vegetarian હોય આપણે જેમ બનાવીએ સ્પિનિચનું શાક by the way આપણે જેમ શાક બનાવીએ it kills everything, all right? Spinach, broccoli, ideally ધોળિયા લોકો ખાય steam કરો, it's best, all right? But the way we make our shark, it kills everything, all right? So we become anemic, especially if you're vegetarian and don't have red meat. Yeah. So there are other reasons for iron deficiency. The body માં કદાચ cancer હોય અને આસ્તે આસ્તે લોહી પડતું હોય બોડીમાંથી. I'll come to the test for that afterwards. Ulcer હોય એમાંથી લોહી પડતું હોય. All right. So iron ઓછું હોય, then a doctor will do all the tests for cancer. All right. If he just gives you iron tablet, no. Tell him what's wrong with you. You're low in iron. Check you out for cancer. Yeah. So ready? Now, middle age my diabetes thigh, then you have to have this test called amylase. All right. Because if your amylase is rising, it is very likely that your pancreas is not well. And you could be heading for pancreatic cancer. And it's like ovarian cancer. Most people, when they get diagnosed of those two cancers, it's grade 4. That means you may not have more than a couple of years to go. All right? So if your sugar level is rising in the middle age, serum amylase must be tested. Tell your GP to check it. All right? Now, in men, there's a test called PSA, but it's not a hard test. It doesn't detect cancer. You could have very high level and not have cancer, and you can have very low level and still have cancer. So it's not the best test for prostate cancer. But my family, my history, oi, brother, uncle, kaka, mama, they've got cancer of the prostate, then it's a good idea to do that. Or તમે પિશાબ કરો અને પિશાબ slow થઈ જાય. This is for men only. Yeah? Pishap slow થઈ જાય or pishap starts spreading everywhere. All right. So that means it is possible because the prostate is getting bigger. Then the doctor will do the PSA test. All right. And the numbers are variable. Malekuch is 0.2 to 2.99. And that's not the figure for everyone. It depends on whether you're 50 to 55, 55 to 65, 65 to 75. It goes up. All right. But the good thing about prostate cancer is that not everyone will suffer badly from it. Only a small percentage. Because તમે 90 વર્ષના માણસ હોય, 100 of them, 90 of them will have prostate cancer, but it doesn't need treatment. Doctor ત્રણ મહિને PSA test કરશે. Okay? But if you've got symptoms that like પિશાબ ભરાવે જાય, રાતના પિશાબ several times ઉઠવા પડે, family history હોય, then get it checked. All right? Now, the other cancer in women is ovarian cancer. And they can do a test called CA125 and a level to 0 to 35. So women ने कितना cancer થાય कितना પારે કે પેટમાં દુખશે. 1 મહિનામાં 2 week સુધી or roughly 2 week નો pain થાય અને પેટ ફૂલી જાય. All right? Within the month for up to 2 weeks, you have to have that test, no matter what age. All right? My daughter, near school friend, she died at the age of 21 with ovarian cancer. Because the GP kept saying to her, it's constipation, it's constipation, it's constipation. But she had ovarian cancer and she had a bloated stomach, पेट फुलતું હતું, gas થતો હતો એને. But she had the test too late. All right. Now, my family કોઈને prostate cancer હોય કે ovarian cancer હોય, there's a relationship, genetic relationship. So એક મેલ મેમ્બરને પ્રોસ્ટેટ હોય ને એક ફિમેલ મેમ્બરને ovarian cancer હોય, then what happens is you have to check everything for the other side, all right, male and females, because there's a little genetic background that it's genetic. All right? So Damayanti Ben is asking, is there any side effect omeprazole? Yeah, there are many side effects. I'll come to that later, Damayanti Ben. All right, okay. And also statins. I'll talk about statins. Next slide, please. So there is something called the NHS app. Many people use it. તમે વાપરો છો કે નથી વાપરતા NHS app? Yeah. It's very easy because મારા blood test કરે તો મારા phone ઉપર આવી જાય doctor પહેલા doctor કરતા I get it the next day. And a button click કરવા પડે and it's called patient knows best. એટલે તમારા laboratoryમાં hospitalમાં કર્યો હોય તમને આવશે અને doctor પાસે બીજે દિવસે જશે test. So you know the results before the doctor. Yeah, so you can do that. Okay. Is that the last slide? I'll come back to that later. I'll come back to it. You can go back to the last slide. Okay, big questions, Chair, in the check. All right, let me just go up a bit. It's a so you can't stop the blood pressure tablet because once you've got blood pressure, it's not going to go away. All right. Hello, can you hear me? Can you hear me?
Yes, we can hear you.
Yes, we can hear you.
Sorry, it's my yeah. Okay, so we'll just press the wrong button there. SGLT2. Right. So who's answered? Blood pressure, the pulse rate is always low. It will be low, but if it's less than 55, speak to your GP. Metformin slow release is better than ordinary metformin દવા ખાઓ તો તમે side effects like પેટમાં ગડબડ થશે, diarrhea થશે, indigestion જેવું થશે. But slow release is આસ્તે આસ્તે release થાય. Metformin તમે ordinary tablet લેવો તો within 3 or 4 hours it will go up. Slow release will take 12 hours to rise up. All right, so it's a better tablet. Are there any side effects of statins? All right, right. Statins are drugs, and a bay effect હોય છે. Statins તમારો cholesterol બહુ હોય, diabetes હોય, kidney problem હોય, heart attack થયા, strokes હોય, and if it's high મેં તમને કીધું, so if it's 4 and આવા problem થયા હોય, then you have to bring the cholesterol to 3 because what some look at from the age of 12 to 13 ની ઉંમર હોય તમારે, cholesterol starts damaging your body then. All right, as young as 12 to 15. Okay, so by the time you get a heart attack at the age of 55, 60, it's too late. You missed the boat. But you still have to try and control your cholesterol. So the cholesterol will start damaging the body very early, very, very early, between the age of 12 to 15. So if anyone starts getting chest pain and angina or strokes or diabetes under the age of 50, it's that much more serious, all right? And we put them on statin. So the next question is, how does it work, all right? So this is the best way to show it, all right? Well, you can see that, can't you? So cholesterol high, there's deposition of cholesterol in there, and તમારા ahoy નાનું થઈ જાય આવી રીતના. All right, block થઈ જાય. All right, artery block થઈ જાય. Heartમાં blood નહીં જઈ શકે, or headમાં blood. The other effect is દેખાય છે ને આ hole. So it makes the hole stronger because ઘણી વાર તમારું pressure હોય, the pressure will make a hole bigger and close the artery. સમજ પડી ને? A doctor, when I give lectures to doctors, they don't talk to patients about that. This closes the artery because it hits the plaque, cholesterol, and a blood will go inside the artery and then it blocks up and then you get a heart attack. Yeah. So it's got two effects. So it does work. All right. It does work, especially if there's a family history, etc. Or you've got diabetes and things. They have side effects, but the latest paper, છેલ્લા 2 વીકમાં જ આવ્યું છે અમેરિકાથી ને અહીંયાથી, કે that માણસો કે આ દુખે છે તે દુખે છે, તો તમે દવા સ્ટોપ કરશો તોય દુખશે. Alright, so those effects are very little. In my life, in the last 40, 35 years I've been giving statins. I've only had two people whose blood test was really bad. The liver test is really bad, muscle test is bad, and I had to stop them. The level was over 1,000 and they were aching and I had to stop it. So two people out of hundreds of people I've put them on. So they're good drugs. They're there to save your lives, all right? Uh, okay. Yeah. I mean, इसी कोने ले कुछ is there a side effect of long-term use statin? Yeah, correct. Um, sorry. Is Lipitor better than for Lipitor, other name is atorvastatin, all right, which is the standard drug now, all right. We used to give simvastatin, but once the name Lipitor was off license, atorvastatin is the standard drug. So if you have something like diabetes, if you come to me, I'm quite aggressive in treating cholesterol. I'll put you on 40 milligrams. Anything below that is a baby dose. All right. If you have a heart attack, you'll be on 80 milligrams. If you have angina, I might even put you on 80 milligrams of Lipitor. So if you've got diabetes and your doctor has put you on 20 milligrams, do you know what? It's not enough. All right. Get the blood test done, all those levels of cholesterol, check it out, check your family history, check your blood pressure, check your kidney test, go on 40. If you've got kidney disease, put it on 40. All right. Side effects are very, very little. All right. Damayanti પૂછે છે omeprazole. Really good question. Omeprazole તમને indigestion થતું હોય, and it's called a PPI, proton pump inhibitor. Um, it does have side effect, all right? So if you've got stomach cancer and the doctor hasn't checked it, and you start taking omeprazole, it will mask it label. The symptoms will be masked and your cancer will get worse and worse, all right? So the doctor has to check you out for an infection. You might even have to put your camera after 2 or 3 months to have a look that there's nothing going on, all right? The other problem with omeprazole is the umar vade, the body માં તમારો salt હોય ને, sodium, એ ઓછું થઈ જાય, all right? Now, normal salt is roughly between 132 and 135. I didn't put it down on my list, all right? Up to between 128 to 132, I can manage it in the surgery, GP surgery. Depends on your GP's confidence. If it gets below 125, it's serious. Very, very serious. All right. I had a patient last year from overseas, and her level was 100 and something, very less, 109 or 110. Seriously, she was very lucky to be alive because the hospital sorted her out. All right. So omeprazole is okay, but on long-term basis, don't. All right. Get it checked by the GP now then. Anil Bhai gliclazide. Now, gliclazide is a group of drugs from something called sulfonyl ureas, all right? Now, they're for diabetes. So how they work is that they kick body mass pancreas, right? Pancreas releases insulin. Insulin acts on sugar and sucks it into the body. Yeah? Now, if you keep taking gliclazide, which is no longer a first-line drug, and a lot of people are on it, I tend to stop the gliclazide and put them on modern drugs, all right? And the modern drugs are things like metformin together with the SGLT2 inhibitor. I sometimes give gliclazide, but it's very low in the profile. Because imagine the pancreas, and you keep kicking it with gliclazide, glabenclamide, glipizide. All these drugs are so your body will empty out of pancreas of insulin. Insulin khalas થઈ જશે, then you've had it. Then you've got to have injections twice a day. Then you're in big trouble. So I'm not a fan of it. I used to give it quite regularly 30 years ago, but in 2026, I don't give it regularly. Yeah, got it? Okay. Any other questions? If you want to ask questions, just ring the bell. Now, ek by I get up 6 or 7 times to go to the toilet. I've been advised not to drink after 4 o'clock. Now I get up 2 or 3 times. Is that okay? Yeah, but it's quite hard work not to drink after 4 o'clock. I have to have my coffee at 8 o'clock at night, and I still get up at night. It's just the price I pay for having coffee. I'm a heavy coffee drinker. I have several, 7, 8 glasses a day. if that, and 2 cups of tea a day. So I think it's hard work not drinking after 4 o'clock. So make sure you check your diabetes, right? Make sure your kidney test is okay. Get your ACR done on the urine. Make sure your prostate test is okay. All right. And if the prostate test is okay, you might need to have a scan on the prostate to see if it's not just generally big without cancer. All right. And depending on your age, that may need doing. But if it's, if you can go from 4 o'clock in the afternoon drinking nothing till 6 o'clock in the morning, you're very brave. I couldn't last that long. All right. But it's an individual preference. All right. So it's an individual thing. Any other questions? Sorry, let's go up a bit. Oops, got me again. Um, there's a question here about is it statin? Your sugar can go up a little bit, but there are also other drugs for blood pressure, like the water tablet for blood pressure, bendraflumethiside. That's more likely to cause diabetes, all right? But it doesn't itself. I mean, there's a slight risk, okay, of getting that.
There's
If
a
your
couple of,
cholesterol
I
is,
think you've missed. Shall we just read them through?
yeah, go on. If your cholesterol is high dose all over your body and
Yeah.
get pain in the, yeah, we've answered that. Yeah. So next question.
Is if someone is on carvedilol for
Carvedilol. Yeah.
yep, for portal hypertension, do you need a statin as well?
Yeah. So if you've got diabetes, if you've had a heart attack or angina, if you had a stroke, and if you had blood pressure, it's imperative that you're on statin. It's standard. You have to lower the cholesterol. And as I said before, even if your cholesterol was 4, when you develop diabetes or heart attack or anything, you have to bring it to 3. Long-term risk are reduced. Yeah. So if you've got a secondary disease, you need prevention. Okay.
Okay. Is next one is it true a side effect of taking statins you can develop type 2 diabetes?
Yeah, there's a small risk, but honestly, it's a long-term prevention. As I said to you, the cholesterol is being deposited in your artery from the age of 12 to 15. Yeah, 12 to 15. All right. So if you just start statin at the age of 50, 60, when you develop diabetes, it's going to have a small effect, but it's not going to prevent your heart attacks. All right. But I'm not saying that all 12-year-olds go on statins because that'd be negligent. You can just control their diet from good health, etc. Next question, Cam.
Okay. What is the best blood pressure for 75-year-old?
I would think anything below 150/90. Yeah, 150/90. I'm fine. I'm not rushing into stopping their blood pressure getting any lower. They have slow growth. I'll keep an eye on them every 3 months.
Mm.
But if their blood pressure is 180 over 100 on a regular basis, you've done it 3 times and monitored at home, I think that needs treatment if they're 75. 150/90, hey, it's not a problem. Nothing's going to happen to you. You're not going to get headaches. You're going to get headaches if your blood pressure is 210 over 110. All right, then I'd be a little bit worried. But you're not going to get a headache 150 over 90. So if a 75-year-old with no other diseases, hey, you're okay. You've made it. You're not going to get ill.
Okay. Will you feel more cold if you have diabetes?
You can do, all right? Because one thing that diabetes can do is to decrease your circulation, all right? If the cholesterol is not controlled, arteries get blocked up and your legs will get cold and your hands will get cold. I'm not saying you're going to get what we call vascular disease, but diabetes itself doesn't cause it. It's the long-term progression of diabetes. Usually, if you have a diabetes for more than 10 to 15 years, these things will happen if you don't have the sugar controlled, cholesterol controlled, blood pressure controlled. So it's important when you have diabetes to have everything as low as possible. Low cholesterol, low blood pressure. Make sure the kidneys are controlled. Yeah.
Okay. Next one is what is the benefit of magnesium supplement tablets and do you get it measured during a blood test?
No. Okay. Um, you might as well get a sort of serum mango level in your blood. I don't do it. All right. Serum magnesium is when you're ill and when you're seriously ill. All right. The hospital do it. I, as a GP, don't do magnesium. All right. But at the moment, I've got a Lithuanian lady I see in Wembley whose magnesium is very low because she went to Lithuania, and she was ill. Her blood pressure was low. So I don't routinely measure magnesium in general practice. So if your GP does, then all I can say is good luck. He may be over investigating you or he thinks there's something wrong with you, but I don't suggest you have your magnesium done routinely.
Okay. What is the cause of dry mouth during your sleep?
Right, really good question. Very good question. All right. So dry mouth can be through a disease, first of all. If you're passing too much water, not drinking after 4 o'clock till 3 o'clock in the morning. All right. But more importantly, it's this, all right, is a blocked nose. If you can't breathe through your mouth, no, through your nose, all right, and I'll tell you why you can't breathe through your nose. You breathe through your mouth at night, and your mouth will get dry. Okay. Now, the reason you get blockage in your nose is in the hay fever season. So from now until June, there's going to be pollen, especially when the rain stops, everything will dry up, the dust, the dirt, everything will come up in the atmosphere, and your nose will get blocked. The other more important thing at home, if you've got carpet in your bedrooms, there's a germ called house dust mite, all right? Okay? And it does a poo in your carpet, in your bed, in your duvet, in your pillows, and you get allergic to the poo of the house dust. It's a tiny little thing, all right? And that blocks your nose up. So if you've got wooden floor, brilliant. If you've got a skirting board, clean it with a tissue, all right? What the house dust mite doesn't like is a bit of fresh air. So in your bedroom, keep your windows slightly open 365 days a year, all right? Now, next question is the pillows, all right? And duvet. Make sure you got non-allergy stuff in it, not ducks down, eider down, all right, all that sort of thing. The more animals you have, animal products you have in the pillow and in the duvet, the more likely you'll get a blocked nose. You'll get allergic to it. Because don't forget, you're in the pillow for 6 to 7 hours there. You're breathing all those animal things. So get a non-allergy. Yeah, you go to Morrison's, you can get 2 pillows for £10. Now, the average life of a pillow is 3 to 4 months. If I asked all of you, when did you last change your pillows? It'll say a year, 18 months, 2 years, or never. All right. I get rid of my pillows every 6 months or less. Get rid of it. Go to Morrison's and buy two, or go to Dunelm. Very cheap pillows. But get non-allergy pillows. All right. Because that's where when I do this, you see, millions of my skin cells are falling here. All right. And luckily in my study here, I've got carpet, so the house dust mite is eating it. All right. And the only way you can get rid of house dust mite, as I say, is through keeping your room cool. Temperature should be cooler upstairs and warmer downstairs. When my children were young, they had teddy bears and little cloth they used to suck on. And when they were asleep, I used to freeze them because the house dust mite dies in a freezer. All right. So if you've got young children or grandchildren, freeze their teddy bears if they're getting blocked nose. And that's why more likely they'll get a blocked nose. They breathe through the mouth and they get dry. Next question, Cam.
Is there a monitor to check HB1AC at home or conversion factor to convert finger prick blood test to HB1AC?
No, there is no finger prick test for HbA1c, but I mentioned the medicine called SGLT2 inhibitor. All right. So when you get sick and you got diabetes and you're on metformin and SGLT2 inhibitor, and these are drugs called dapagliflozin, empagliflozin, all right, your sugar level will be okay because normally when you get sick, your sugar level goes up. All right. But there is a test in the blood for ketones. That means you're burning fat. And if that sugar ketone level is high, not the sugar level, ketone level, then you have to be in hospital. You're seriously ill. But the sugar level won't be very high. You can do that at home. But you have to ask your GPs to help you with that. You have to be taught how to use it. Yeah. Next question, Cam.
Are you saying don't take omeprazole or only take it when it is necessary?
Yeah. if a GP is going to put you on long term, so if you've got peptic ulcer, duodenal ulcer, stomach ulcers, you're okay. But if you suddenly in middle age start getting indigestion, my feeling is short term omeprazole is fine, but if your indigestion or acidity comes back, get it checked. And the best way to check it through a camera, or they do a breathing test or a stool poo test for something called Helicobacter. Yeah. And then we treat the infection with high dose of antibiotics and omeprazole for 1 week, and then repeat the test in 3 months.
Next one, if someone gets up many times to use the bathroom, that is it better to have prostate test for cancer and get a PSA test done?
Um, right. So first of all, the GP, I presume it's a man who's asking the question.
It doesn't say.
Doesn't say. Okay. So first of all, let's start with men. If you're passing too much water at night, all right, first thing to exclude is diabetes. All right. So the symptoms of diabetes are you drink too much, you pass too much, and you have weight loss. So, all right. So you drink too much water, you pass too much water, and you have weight loss. Okay. And that's symptoms of diabetes. Symptoms of prostate disease, if it's a man, you'd pass more water than normal. All right. Well, so if you pass, say, water twice a night and suddenly it's gone up to 5 times a night, there's something wrong with you. Either you've got diabetes or prostate problem or something else, all right, or kidney problem. So that needs to be checked by the GP from the blood test. Now, the PSA test is not a cancer test, all right, because as I said before, you can have a high PSA because your prostate gland is big, but have no cancer. But you could have a slightly raised PSA, pass too much water, and that could have cancer. The only way you can have that checked, whether it's cancer or not, is to have a biopsy. And nowadays they're very complex, all right? You do in the old days we used to do a blind biopsy. Now they do an MRI test, magnetic resonance imaging, and at the same time they do a biopsy, so they don't miss it. So it's much more accurate. All right. So if your urinary symptoms are getting worse, and with men, rather than getting a single jet like this, yeah, it'll spray everywhere. You're wiping it from the floor, wiping it from the seat. If that's happening as you get older and you're passing more water, get your prostate checked. Yeah. Next question.
Okay.
I hope the questions are being answered. I'm not fobbing you off. This is I'm just telling you from experience.
After a blood test, I had a pharmacist ringing to put me on statins without seeing a GP. Is that normal practice?
Yeah, it's becoming normal practice. So GPs are left to do more and more complex work. So all practices now have something called nurse practitioners, advanced nurse practitioners, or clinical pharmacists. Pharmacists are given protocols to follow. So, say if I had a blood test today and my cholesterol is raised, all right, the GPs have given a protocol to the practice pharmacist to talk to you. All right. They're not doctors. You still have to remember that. If you're not sure, make an appointment with a doctor. All right. Or discuss it with a doctor. But they're trained, they're suitably trained. So all practices have one or two what we call attached pharmacists. And they do really good work. All right. They have very specific things. So that's okay. That's okay. But if you're not sure, speak to the GP. But they're trained, right? They're not sort of someone you pick up from the street and say, "Oh, come and work with me and give my patients with a cholesterol of 5 statins." They're not like that. They're highly trained.
Okay. Next one is what causes dry eye?
Really good question, all right? So we've all from time to time get dry eyes, uh, Suki Jack. Um, but if it's persistent, it means that you haven't got enough tears, all right? So you have to go to the doctor and tell them that you're getting dry eyes. If you're getting dry eyes and a dry mouth, all right, that means you're not producing enough tears and the mouth is very dry, you may have what we call something called a connective tissue disease, all right? All right. For the dry eyes, the GP may give you artificial tears. You can buy them. They're called Hylo tears or whatever from the chemist, but they're terribly expensive. All right. When I had my cataract operation, I just bought them after because my eyes felt dry one day, and they're about £15 a bottle. So it's rather you get it from your GP. It's free if you're over 60. All right, so it's not that. But if you're getting dry mouth and it could be different, and they can do a special blood test to find out whether you've got a connective tissue disease. All right. But by and large, majority of the people can get away with artificial tears. All right. But speak to the GP. All right. They'll know better. They'll know better than the nurse. They'll know better than the pharmacist. Because we're the ones who are trained in medicine.
Okay, next one is does omega-369 help if taken regularly?
Yeah, you know what? Send the money to my pension. That's all I say. Don't buy this rubbish. I just increase my pension money. All right. All of this, most things are rubbish you buy from the chemist. They've got to make money somehow. All right.
Fish
Hope there are
Callum.
no pharmacists there.
Okay. Some of these aren't know your numbers one, but I think guess people are taking the
Yeah,
opportunity.
no, no, it's all right. Look,
If that's
it's
okay.
it's it's fine by me. I'm here to help. Help in a way that I'm directing you back to your GP somehow.
Yeah. Okay. Next one is why do I get lots of saliva sometimes even when I'm talking? Like I'm going to dribble and sometimes my mouth is so dry, even my lips get really dry.
Okay. Some
Okay.
people produce a lot of sweat. Some people produce a lot of saliva. It could be that you've got a problem with the salivary glands, all right, where the saliva comes. So as soon as you think of food, you chew some food, saliva is produced by these glands that are here, all right, in and around the mouth. And your mouth is full of saliva. They have acid, so they digest the food as it goes down. Yeah, so you need saliva. You can't survive. If you don't have saliva, the food will get stuck there. All right, and you have to drink a lot of water. And if food gets stuck there, it could be either a problem with saliva or a blockage in your tube that goes down, something called esophagus. Yeah, got it? But that needs checking. So don't just sit on it or start taking omeprazole or Rennies or something. The food gets stuck there, get it checked by the GP. Um, Other reasons that can get your dry mouth, there could be a thyroid problem, it could be a parathyroid problem. So there are many other glands. If it's persistent and it's going on for more than 3 to 4 weeks, get the GP to check it out.
Okay. Next one is please comment on cooking with ghee, butter, nut oil, and seed oil.
Right, let's start with cooking. Oil. So what you want is vegetable oil and as little as possible. All right. Seed oil's all right. Nut oil can be okay, but some people get allergic to it. Ghee and butter taste nice, but not great. It's purified cholesterol. So as little ghee as possible. All right. Um, I go to Weeby and Sons locally, and they got great big gallons of ghee. I mean, I don't know whether it's sort of for home or for industry. I don't know. I don't know. But vegetable oil is the best, right? If it's sunflower oil, it's probably better than vegetable oil. If you just got vegetable oil, it's a mixture of all sorts of rubbish or vegetables. I don't know. But sunflower oil is sunflower oil, and it's probably better and as little as possible. All right.
Okay, thank you. How can you cure mouth ulcer?
Really good question. So first of all, if you're getting recurrent mouth ulcer, you've got to try and find the cause for it. All right. If it's a one-off thing, not a problem. It'll get better. Some people get mouth ulcers because they have sensitivity to citric acid, juices from orange, lemon, that sort of stuff. All right. Citric fruits, and they age it and they get a mouth ulcer. More seriously, people who suck katho, betel nut, sopari,
Mm.
they'll get cancer in the mouth. So if you're doing betel nut, sopari, or katho, get rid of it now. All right. Your skin is already damaged, and if you're on the side of the mouth, look in the mirror. If you've got white patches, go and see your dentist or go and see your GP and say, "I've been sucking betel nut, sopari." All right. And that's a serious thing. And the other thing that happens with sopari and betel nut is, you see, watch me open my mouth wide. They can't open their mouth because everything tightens up, and that's precancerous. All right, you're going to get cancer of the mouth, full stop. So if you can't open your mouth wide, get it checked by the GP or a facial surgeon or the dentist, and they'll do the right tests for you. But cut out sopari. You go to, I don't know, a restaurant, you have couple of beers or no beers, or you have a pan afterwards, make sure there is no catho or supari in it. Right? They do it for taste and everything else, and you get your red spit. That's why if you go to Southall or Wembley, there are little signs on the post:
Mm.
"Do not spit, £100 fine."
Mm.
Next one.
I have a stone on my gallbladder. If no pain, then I still have to go for surgery.
No, you don't. Gallstones. If I had 100 people sitting here today, I don't know how many we've got today. Um, 80–90% will have a gallstone. But unless you're getting paid, you don't need anything. Don't go for surgery, because any surgery, minor surgery or major surgery, has a complication of anesthetic, complication of infection after the thing, and other complications, operative. You might not get the most senior doctor doing it. You might get a junior doctor and make a mess. So if the gallstones are there, unless they're causing severe pain and your eyes are going yellow, leave it. They're not worth treating. I don't bother unless people are in pain.
What if they say it's better to have the surgery?
No, it's not. As I just say, it's complications.
Mm.
Everything's got complication. Simple anesthetic complication, laparoscopic surgery complication, operative complication, post-operative complication. Gallstones, by and large, majority of the people will have some as they get older. So leave it unless it starts causing pain. All right? Unless it starts causing pain.
Okay, what's the reason for eyes to leak like tears coming out?
What's the reason for?
Eyes to leak like tears coming out. So
Yeah.
severe, yeah,
So
yeah.
babies are, if you've got young babies, their eyes are always getting tears, all right? It's because the tear duct, tear ducts are produced there at the top, and it goes down, and at the bottom, they suck into a little tube, and it goes to the back of the nose. If your skin is blocked and the tubes are blocked, you'll get tear duct blockage. If your tear ducts are grown, all right, they become hyperactive for whatever allergy or anything like that, you'll get more thing. Some people get a lot of tears when they go out in the cold weather, like I do. If I go out in the cold weather, my eyes will get tears, but it might be blockage. So you need to go to the GP, or you can go to the optician, and they can have a look to see if your tear ducts are blocked, and that's why you get tears. Yeah. Okay.
Uh, what about stomach ulcer? I suppose
What
that's
about it? Right. What about stomach ulcers? Well, stomach ulcers are usually due to acid, hyperactivity of acid. But if I get a patient with stomach ulcer, I don't diagnose it. I usually, after 2 or 3 weeks, and if there's still persistent pain, I do an infection test for the Helicobacter test. Either they can have it in the poo, they can have it in the blood, or the best way I do it is a breath test. I give you a little kit, and you do a little chemistry test at home, all right? And you breathe in, and it's the first test after 6 hours fast in the morning, goes to the laboratory, and the GP gets the results. And that's the best test, all right? The breath test. If it's positive, they get 2 antibiotics in a high dose and omeprazole on a high dose for 1 week. And then we repeat the test again in 3 months. All right. Once you've got a blood test that's positive, it's always going to be positive. So it's not a great test. All right. The poo test will be positive now, but once you treat it for Helicobacter, it can, what do you call it? It can become negative after several months. All right. So it's not a bad test, but it's not 100%. But the best test is the breath test. All right. Now, if someone has got duodenal or peptic ulcer, I wouldn't put them on long-term PPI, omeprazole, or something like that for long term without a proper diagnosis, which is a camera in the mouth. Okay. Nurses and technicians are now heavily trained, so a doctor doesn't have to do that anymore. They have
Mm.
somebody called nurse consultants who will do it for you.
Okay, we've got a few more questions. I know you've got one more slide. Do you want to go through that, or it's your
Uh,
photos? Or
uh,
do you
uh,
want
uh,
to?
yeah, where's the last slide, Kirti, then?
And then we'll carry on with the questions.
Yeah,
Then we
yeah.
can stop sharing then.
As I said, there's no football match today. Right. So this is me with the hair and glasses when I was 18. And that's me now. No hair and no glasses. The reason I don't wear glasses anymore because I had both my cataracts done. Right? But I went to medical school in 1976. So if your sums are good, that was 50 years ago. All right. So I came into the NHS 50 years ago. That's a lifetime. All right. And and I left medical school 45 years ago, and I've been a GP for 40 years now. So sadly, as of next month, I'm going to give up my license and stop seeing patients. I'll still teach, examine, and interview at two medical schools, but I will, from the 20th of March, I will no longer see patients. I'm giving it up, despite the fact I love seeing patients, which is my forte and always been my forte. I worked it out a few weeks ago. I've seen between 3 and 400,000 patients in my life, for luck, from 1976. So I think I've done enough for the NHS now. No private work, no NHS work. So I'm going to retire as of 20th of March completely. I'm giving my license away. So that's what I look like. That's what I look like. I look quite young then with the glasses.
Look,
Better smile then as well. My wife
Look,
says I'm
Still
very
be
a
able to
grumpy
give a
old man
stroke,
now.
Harish bhai. Will you still be able to give a strokes although you give up your license?
I can give talks, okay, because it's my 50 years of experience is not going to go out overnight. But there are certain things I can't see. All right. I can't sign a prescription from 20th of March next month. So there's no way I can see a patient. All right. But because people ask me questions like now, I can give you some general advice for another couple of years, maybe. And by that time, I'll be 70 years old. I'll be 68 in 2 weeks. All right. And I just decided in the last 3 months, 4 months, I think I've done enough for the National Health Service. Does that help you, Jasuben? Jasuben, does that help you?
yeah, yeah. We'll still call upon you. Okay,
Yeah.
if we stop sharing, well, we've got a few more questions, and I
Yeah,
think
go on. Fire
people
away or
do.
let them unmute and ask me the question.
Yeah, well, there's still a few questions on the chat, so people I think have been getting used to this, which is very good with the technology. And then we'll ask people to unmute themselves. So if you
Right.
have,
I'm
the
just
next
I'm just
question
seeing
is,
my foy there.
okay, okay. If you have family history of heart problems, should you go on statins? And can they have dissolvable tablets as he has swallowing issues?
Um, there is no dissolvable tablets, but if you've got a family history of heart disease, the first question you'd ask, do they have heart attacks under the age of 50 or under the age of 60? All right. If they have heart attacks under the age of 60, it is very likely that the cholesterol issue is familial. Familial means it runs in the family, right? And there are certain types of cholesterol. Your GP and me, I can't do a test. It's if you want to be really clever, you can ask your GP for something called lipoprotein small a test. All right, and they'll say, no, no, we don't do that because it's expensive and it's not done. So you may have to see a lipid specialist. So if you've got a high risk of people dying under the age of 60 in your family, all right, um, and you're worried, then go. If you're 75, look, if I do your cholesterol at the age of 75, which I won't, then it'd be very unlikely I'd do it unless you've got another disease like heart disease or diabetes. And you've got a high cholesterol at the age of 75 or 80, leave it well alone because I want to find out what is it about your cholesterol at the age of 80 that you've not had a heart attack yet. There's something good about your cholesterol. But if your cholesterol is high at the age of 49 and you've got a family history, then you've got a problem. So if you're 80, 90, leave it well alone. Don't look for problems. All right? Don't look for problems. If you're 80, your cholesterol is fine. All right? So don't worry about it. Don't give you, it's very unlikely if suddenly, some doctors do it, and when I do my locums now, I pick it up and then I have to tell them, yes, it's high, but you're 80, you've got no problem. Go out and enjoy yourself. You know, have some more ice cream, have some cakes. Don't worry too much.
Okay. Why does mucus build up in my throat and nose?
Okay. First of all, good question again. It could be the allergy thing we talked about earlier. It could be you've been a smoker. All right. Um, Or it could be that you've been exposed to dust in your job, industrial job, or in the house, like building works and things, all right? So if it's quite a lot of mucus, get it checked, because so if you're a smoker or you work in a smoky area, what happens is you damage the glands in the lining of your lungs, all right? And then when you stop smoking or come out of the area where it's dusty, you produce more mucus, all right? That mucus can actually cause a lot of problem. You know, coughing at night, it gets stuck, you've got to spit it out. But more importantly, if there is blood in it, go to the doctor tomorrow and get a chest x-ray. Yeah, coughing up blood. If I say blood from any hole in your body, ears, nose, throat, back passage, urine, to me, that's what we call a red flag. I've got to investigate that further until proved otherwise, to exclude diseases such as cancer, serious disease in the lungs. Yeah.
Okay. Thank you. What is a platelet count and what does it tell?
Really good question. All right. If you came to me 40 years ago, I wouldn't have worried too much about your platelets. All right. But if you come to me now, I have to look at your old platelets. All right. Now, those of you who don't know what platelets are, when you cut yourself, you know, if you may accidentally cut yourself, we produce something called fibrin, and it makes a little mesh network like net curtains. And in that net, the platelets are little things from the blood. They stick it and stops you bleeding. Yeah, it's like a bandage, natural bandage. Now, since about 2015, the guidance on platelets have changed. All right. So for men, if your platelet count, the upper limit is 450. Yeah. So for men, if your platelet count was 300, and then a year later it's 350, and now it's 440, I would be thinking, what's going on here? Is there something going on in the background? Is there a bone marrow problem? Is there a blood problem? Or is there cancer brewing in this body? So it's like a sixth sense, all right? So one-off platelet count doesn't matter. So it can be important. And it can be also important in women, but it's slightly different. So if women are still menstruating, having periods, they bleed, so they produce more blood from their bone marrow, their platelets are always a little bit high. If they're anemic, the platelets are also a little bit high. So it's again individual interpretation. If the platelet count is rising over time, it's very, very important that it's followed up by the GP. Good question.
Good. Okay. Next one. Why do I get numbness in feet?
Really good question. So first of all, if you're a vegetarian, I would get your vitamin B12 and folic acid done. Okay. Because long-standing vitamin B12 and folic acid deficiency will give you numbness of your feet. All right. The second thing is if you have diabetes, because as I said to you right at the beginning in the talk, you can't get rid of diabetes, but what can happen is diabetes causes long-term damage. And one of the early sign of diabetes damage is numbness in your feet. So when you go to the doctor, he'll get something called a tuning fork out. This is my spare one. So this is called a tuning fork. Okay. So he will do that and put it on your feet. And if you can't hear the vibration, that's an early sign of diabetes damage. All right. Vibration sense goes. Yeah. Can you hear that? Yeah. The vibration sense, you put it on your knuckle, oh, I mean, not knuckle, the bones in like the ankle. And if you can't feel the vibration, so that could be the numbness. That's a very early sign of diabetes damage. The longer you have the diabetes, the longer your sensation will go, the quicker, you know. So that could be a problem as well. Other reasons are drugs. All right. So if you have treatment for, if you're unlucky enough to get breast cancer, you know, some of the drugs for breast cancer, you know, anastrozole, amistrol, it'll give you numbness. If you've had chemotherapy for other diseases, all right, even if you had something like rheumatoid arthritis and things, long-standing side effect is numbness, all right? Rheumatoid arthritis, osteoarthritis. So don't ignore it. Get it checked. And they can do nerve studies, all right? So they put an electrode there, and they put an electrode there, give you an electricity, goes through that, and it will show you whether you've got real numbness or you're just feeling numbness. Thyroid disease can give you. If your thyroid stops working and you get something called hypothyroidism, you'll get numbness. All right. So many other reasons. There are hundreds of reasons. But it's not just a one-off thing. But if it's persistent, get it checked.
Okay. Next one is what causes night cramp?
Really good question again. So night cramp could be due to lack of salt. We've been told not to have more than 6 grams of salt, but some people go over the top and don't put any salt at all in their food, and they can get cramps from that. All right. What's good sometimes for night cramps is, firstly, if you buy something called low salt, sorry, not slow salt, low salt, that's got low sodium, but it's got slightly higher potassium in it. Go to Morrison's or Tesco's, low salt. And sometimes increasing the potassium from that, increase the potassium by not lots of bananas, a bit of tea, and orange juice, they all got potassium. So that can stop it, all right? If it's persistent, and if it's really causing you a lot of problems, I sometimes give quinine, all right? When I've had night cramp, I've had to go to the fridge and get some tonic, my gin and tonic. My wife said, "What are you doing?" I said, "I'm going to get some tonic because I got a night cramp." Because you stretch your leg and it's so painful, you can't bend it back. We've all had it, or if you do long distance driving, but you can sometimes that can get rid of it. It's kinchicine from tonic water.
Okay. Just a message to thank you from Jotnaben in Manchester for answering your questions. Thank you very much, and organisation. Another question: lately, having difficult to balance, like on one leg, in brackets yoga, normal BP. Why? I am.
Right. It depends on the age. All right. So the balance mechanism. Let me just go back. The balance mechanism. We have what we call receptors in our knees. All right. And we have our eyes. All right. Now, if you close your eyes and put your feet together and you start swaying, that means your balance mechanism is not good. That means as you get older and you're not exercising or walking enough, these proprioceptors are dying. So if you don't exercise, your muscle dies, all right? And that's a natural phenomenon. So the more, even in this cold weather, wet weather, put a coat on and go out. So when your proprioception receptor goes in the joints, you will fall down, all right? So the simple test is you stand near a bed, all right? Put your feet together, close your eyes and put your hand up. If you start swaying like this, you got trouble. The other thing is trying to stand on one foot, all right? You should be able to do it for 30, 40 seconds, depending on whether you've got arthritis or not, all right? And do the other side. And if you start wobbling a bit, start exercising first, all right? And that will help you. There are many millions of reasons for it, neurological reasons as well.
Okay. A couple of thank yous from Champaben and Jackson by. Please keep hosting these sessions. He's 71 and his cholesterol levels are normal range. So does he still have to go on statin?
Has he got any other disease such as diabetes or heart disease? If it's 70 and it's normal, no, he doesn't need statin. But I said, don't cause a problem when you haven't got one.
Is it advisable to go for an iron infusion if iron levels are low and the tablets are not working?
Yeah, really good question. All right. I've got a friend who just does private hematology where he qualified together, and iron infusions can be dangerous. You can get allergic reaction, but or if your iron level is very low. So in this area in northwest London, if your hemoglobin is less than 8, and now they're saying it's 7, they won't give you iron infusion or a transfusion. All right. A private doctor will give it, but then they get the money, you see, with the iron infusion. But if your iron tablets aren't working, because I don't know what sort of iron tablets you take. Things have changed here, because if you came to me about 35 years ago, I'd give you 3 iron tablets a day for 3 months, and that should bring it up. But we now know that that doesn't work that well. So the latest guidance is if you're short of iron, we give 1 iron tablet a day with orange juice or vitamin C. All right. Now, we used to give vitamin C tablets in general practice, but we no longer can because it's expensive. You get your vitamin C from orange, squash, that sort of stuff, all right? So if you have an orange juice or satsuma with an iron tablet, one tablet a day. But having said that, iron tablets can also give you diarrhea, stomach pain, and black stools, all right? So they're not without side effect. So the iron infusion can be a thing, but it has to be decided by the hematology doctor. But it can help, yeah.
Okay. Um, there's a few more questions. So just to let everybody know, we're going to probably close off. It's an hour and a half. A few more questions and thank you. So just go to the last few. Um, what is the reason for persistent low neutrophil count?
Neutrophil count.
Neutrophil count, yeah.
Really good question. Now, neutrophil count can be a racial thing. So Afro-Caribbean people always have a low neutrophil count. Some people, Asians, can also have it. But if it's persistently low, you have to make sure you're not taking a medication that's causing low neutrophil count. All right. And there are medications like um, medications for diarrhea, for ulcerative colitis, for arthritis. They can give you low neutrophil count. All right. If it's persistent, find out what the cause is. All right. But it's not a usual low thing. But in Afro-Caribbeans, it's always low. Don't know why, but it's that genetic issues.
Next question is, my grandson is only 7 years old and has this kind of cough stuck in his either chest or throat. So every now and then he coughs, and you can hear his sound of the cough in the chest, but he just can't get rid of it.
Really good question. I think your GP needs to listen to his chest and take a history. If the chest is still making a noise, he needs to be referred to a chest physician. All right. Have a chest X-ray and chest physician. It needs looking at. You shouldn't have a rattly cough. All right.
Couple of thank yous from Takrabai. Thank you, Dr. Harish. And I'm wishing Harish a very happy and healthy long retirement. Thank you for the Zoom talks. Thank you for a very informative session. One question, I think this probably the last one. I have been suffering from persistent cough for nearly a year now. Had various tests done, but as yet have been diagnosed with any medical
All right.
condition.
Right. So first of all, persistent cough for a year is not right. All right. So if you're a male and working, or if you're maybe female and working, make sure you've got a chest X-ray done. If the chest X-ray is normal, then try and insist on getting something called HR, high resolution CT scan. All right. We GPs can do it as well. Just form it and ask for chronic, and they need to listen to your chest. Last week I was examining students, final year students, and both my patients, they had lung disease, and they had little noises with my stethoscope. All right. And that little crackly noises. So depending whether your GP has listened to your chest, then you go and see a lung doctor, all right, and they can do a few tests. But cough for a year is not abnormal. Sometimes, as a blind therapy, we give a steroid inhaler, a mixed inhaler with steroid with something else for 2 or 3 months. If that goes, that's fine.
I think, yeah, just people saying thank you and happy retirement. So
Thank you.